Thank you so much, Fabio, and I hope you can hear me well. Greetings from Bhutan. So I hope that the connection will be stable for the entire duration. I'm very grateful to be here, and I really would like to thank the e-learning Academy for this great opportunity of developing the course on costing and monetizing nutrition benefit. This course is part of a series where we will be looking from the design to the costing to the economic evaluation of agri-food system investments that have a clear nutrition outcome. Before we start the discussion, I would like to present some of the facts from the first module, which is on the agri-food system pathways to healthy diets, presenting the stepwise approach. And these are some of the figures. So the course was launched in August 2023. And so far we have 2,733 learners. After we launched the course in English, we had it launched in French and in Spanish. And here you can see some of the stats. So we have a good number of participants that take it online, although you can see that there are also several that need to download the course. There is a very good gender balance in taking the course. And when we look at the region, we are very proud to see that almost 70% are from Africa and Asia. We would like to see an increase in the participation from South America, especially given that there is the e-learning in Spanish. And by type of organization, we are very happy to see that there is engagement individual as well as from university. So it's great for us, a good representation from academia. In the future, we would love to see more engagement from the government as well as from NGOs. And also we are very happy to see that at least 5% are from the private sector, and we hope to see again more engagement from them. So these are some of the figures, and I'm very pleased to now move into giving the floor to our testimonials, starting with Dr. Zarina, Principal Assistant Director at the Ministry of Health of Malaysia. Dr. Zarina will discuss 2 of the 4 steps in the agri-food system pathways to healthy diets approach in the context of the ASEAN model. Dr. Zarina, if you are ready, we would be very pleased if you can share your presentation. Thank you so much, and I hope that you can still hear me loud and clear. Thank you.
Thank you, Ms. Moderator. Let me share my slides. Okay. Did you see my slides on screen?
Yes.
Okay, good. Thank you again for the kind introduction. Today, I will share my experience using the agri-food system pathway to healthy diets approach in Malaysia. In highlighting how its guiding principles support the development of a multi-sector model for sustainable food systems and healthy diets in ensuring food security and nutrition across Asian region. The project is led by Malaysia and is ongoing from 2023 to the end of 2026. It is in line with the Asian Leaders' Declaration on Ending All Forms of Malnutrition, which strengthens commitment to addressing all forms of malnutrition and diet-related non-communicable diseases. The core objectives of this project align with the Asian goal of mobilizing multi-sectoral efforts and strengthening regional policy standards. These efforts will yield a model that aligns with global health priorities and reinforces Asia's role in advancing inclusive, resilient, and sustainable development across the region. The Asian sub-region is currently facing the ongoing challenge of the double burden of malnutrition. About 27.4% of children under 5 experiences stunting, is the second highest rate in Asia, while 8.2 are affected by wasting. At the same time, overweight and obesity have increased almost 7-fold over the past 35 years. While overweight and obesity continue to rise, progress in reducing undernutrition remains slow. The situation is further challenged by the limited responsiveness of food systems to nutrition in the region. Current Asian food systems do not consistently support healthy diets, with unhealthy foods often being more accessible and affordable than nutritious options. Stakeholders frequently work in silos, and nutrition is often treated as a secondary priority. Even when initiatives to improve diets exist, key actors may not fully understand their roles or collaborate effectively. So, to tackle this issue, a clear action framework or model to identify gaps and opportunities within the food system, as well as the roles of key actors, need to be established. Coupled with a platform for engagement and collaboration, such as framework can provide clear pathways for coordinated action and targeted investment. This slide shows the steps in agri-food system pathway to healthy diets approach. Until now, for Malaysia's Asian project, the first 2 steps of this process had been completed as of early 2026. As part of a partnership between Ministry of Health Malaysia, Asian member states, and FAO, we are developing a sustainable food system model using a multi-sectoral approach guided by the agri-food system pathway to healthy diets framework. Drawing on national and regional platforms, the first 2 steps of this process have been completed. Through a participatory process involving all member states, FAO has conducted a situational analysis by collecting data from resources such as the National Action Plan for Nutrition and Agriculture and also Tufts University Food System Dashboard. The analysis were verified through bilateral discussions with all member states and further through a consultative meeting in November of last year, where 3 models were developed: undernutrition, overnutrition, and the triple burden of malnutrition. These 3 models visually highlight the challenges, gaps, priorities, and opportunities at both country level and sub-region level. Each framework is accompanied by a set of indicators and responsible stakeholders. A theory of change will also accompany each framework, looking at solutions to the problems identified. In 2027, Asia aims to build upon the situational analysis by developing a framework of action. The framework of action will be piloted in 2 Asian countries. Guiding principles from Step 3 and Step 4 of the pathway approach might be used at this stage. So that's all my sharing today. Thank you.
Thank you so much, Dr. Zarina, and it's really great to see the application in a real context. So I'm very pleased now to pass the floor to my colleague, Clément Lorvao, and he's Senior Nutrition and Agri-Food System Specialist in FAO. And I'm very pleased to have you here because you have been one of the originator of the agri-food system pathway to healthy diets. And Clément will introduce us to the full pathway approach using the experience of Madagascar. Clément, over to you. Thank you.
Thank you very much, Patricia. Can you see my screen? Now I will project the slide.
Yes.
Can you see it? Yes?
Yes.
Yes.
Okay, great. Thank you. Thank you very much. So today I will, as Patricia said, I will share the experience from Madagascar on how agri-food system pathways to healthier diet can support healthier diets, focusing on a project that tested this approach in a highly vulnerable region of Madagascar. As we already mentioned, the overarching objective of FAO agri-food system pathways to healthy diet approach is to support policymakers and stakeholders to identify concrete actions and policies within agri-food systems that can promote healthier diet using a structured multi-stakeholder consultation process. So as already mentioned by Zarina before, it's a stepwise approach that looks first on the conduction of the situation analysis to identify key challenges in diets and nutrition. Second, we developed a tier of change based on the most critical priorities problems. Third, we identify pathways that connect agri-food intervention to transformative actions and nutrition-sensitive indicators. And finally, we validate the tier of change in the pathway with the stakeholders. So the approach, as a reminder, uses the agri-food system framework developed by the HLPE that looks at the entire chain from external drivers to diet. So we consider systems that support food production, such as ecosystem or health systems. We look at food supply chain, and on top of that, we analyze the food environment. Finally, we look at consumer behavior and diets themselves in terms of quantity, for instance, balance, diversity, and adequacy. So this system's lens is essential to understand where to intervene if we want a healthier diet, not just more food. So using the framework, we identify entry points across the food system, looking at potential project actions, outputs, outcomes, and also impacts. So we relate them to external drivers like climate change, globalization, or trade. The aim is to support diverse, healthy diets while being explicit about what needs to change, where, and through which actors. Here, it's just a reminder, but Patrice already mentioned it. We developed an e-learning on the agri-food system pathway that is available in French, Spanish, and English. But we also developed practical publication that guide users through the steps of analysis, pathway design, and indicator selection, and everything is available on FAO websites. So now let me turn to the experience from Madagascar in Fitovinany region in the southeast of the country. So FAO implemented a project called Enabling Healthy Diet for the Prevention of Child Wasting. The project supported about 500 vulnerable smallholder households, focusing on children at risk and pregnant and lactating women. We used the agri-food system pathways approach and the benefit cost analysis tool to quantify both the costs and nutrition benefits, and to generate evidence to inform future scale-up and investment decisions. The situation analysis revealed a very challenging context in Fitovinany region. Under 5 child mortality in the project region was among the highest in the country, and cane nutrition and diet-related indicators performed worse than in the rest of the country. For example, low body mass index were more prevalent in the region than in the rest of the country. And beyond these numbers, we saw a combination of high child morbidity, wasting, and stunting, poor dietary diversity, and strong gender inequalities as well. So the intervention was designed to better contribute to more diverse diets for infant and young child feeding and for women. It promotes the uptake of climate-smart nutrition sensitive agricultural practices using the farmer field schools to increase availability of selected nutrient-dense plants and also animal source foods. At the same time, the project worked on the development of and consumption of locally produced nutrient-dense recipes tailored to the needs and actual consumption patterns of the targeted groups. Gender considerations were integrated through focus groups, discussion, saving and loans groups, and listening clubs. And the monitoring of an evaluation plan focused on child feeding practices, but also assessed the minimum dietary diversity score for both women and children. So the Madagascar pathway that has been developed by our team covered three main components: the supply chain, the food environment, and the consumer behavior. Each sub-pathway linked project activities to outputs, outcomes, and impacts on diet diversity and child wasting. And using the pathway tool forced us to be more explicit about how each activity, from inputs to impacts, was expected to change diet and nutritional status. This clarity provides the backbone for benefit cost analysis, because we could link specific costs to observable results along the pathway and generate evidence that can guide future policy and investments. So unfortunately, we don't have time to look at the overall pathway, but here I'm sharing a snapshot of the sub-pathway that has been developed specifically for this project in Madagascar under the consumer behavior component. So there we focus on three categories of outputs: nutrition counseling, sensitization on dietary diversification, and the conduction of cooking demonstrations. So here you can see that the pathway captures changes in knowledge, attitudes, and practices on child feeding and women diets, including social norms, but also intra-household decision-making. So by tracking these behavioral changes along the pathway, we can see how the project contributes to a more diverse and adequate diet, and ultimately to a reduction in child wasting. So this is the end of my presentation, but my colleague Tiken later on will come back to this specific example and will show you how this pathway can be linked or applied to the BCA tool. Thank you.
Thank you so much, Clément, for articulating so well why it is so important to have the pathways as the foundation. Now we are turning to Dr. Connolly, who is Global Health Economics and Financing Consultant. And Helen has been the main author in the development of the methodology for costing and monetizing the benefits of integrating nutrition in agri-food system investment. And I'm very glad that she will be here and guiding you through the process on how to do costing and the monetization of benefits for nutrition. Over to you, Helen. Thank you so much for being with us.
Thank you, Patrizia. So as Patrizia said, I'm here to talk to you about connecting the pathways. And I'm going to stop my video because I'm having some slow streaming. Connecting the pathways that were talked about in the earlier presentations to costs and benefits and how to connect those pieces. So when you're looking at the pathways, we start with the problems. We figure out what the activities are that will alleviate those problems. And then from there, the pathways will lead you through what the outputs, outcomes, and eventually what the impacts will be. I'm going to explain how we connect those pathways. And this is the big picture, and then I'll go into details as the presentation goes along. So the first thing we do is we identify the costs for the activities. And as Clement has said, in the project he was working on, they were able to take the activities and figure out what the inputs were. So if you have inputs, you can get much more detail. Some costing is activity level. The tool that FAO has developed allows you to do both. So what we want to make sure is that we work with the data that we have, and as we produce more evidence, we can refine the tool and we can refine the evidence. So the next thing we do is we look at every level of outputs to impacts and say, what are the benefits that are coming from that? What do we know is going to happen? So are we increasing certain types of food in diets? Are we at the output level? And then it impacts, we're improving healthy diets overall, right? Decreasing BMI or increasing nutrition. And then the last thing we do is connect those costs to the benefits that we have found. So how do we do this in practice? The FAO cost benefit analysis tool, so CBA, I'll be saying that a lot, CBA, was developed to provide a standardized approach to performing the cost benefit analysis within the agri-food systems investments. And along with the methods note and e-learning, support FAO staff to perform analyses. So the tool was built in Excel to provide the most accessibility to people because most people have Excel as a tool. And it aligns with the structure of the agri-food systems pathways to connect the activities to the costs and benefits. So it was designed under the assumption that an economist who has the knowledge of CBA and the approach will work in conjunction with nutrition program experts who have the context and the knowledge of the program pathways. So it should be a joint effort, collaborative through the entire process. Together, these users will need to provide information about the evaluation plan and the assumptions required in order to answer the evaluation questions. And here I'm talking about cost evaluation questions. The details of the program, the details of the agri-food systems pathways, the resources and inputs required to conduct the activities, and also any information about the resulting impacts and benefits. And that's both monetary and non-monetary. We recognize that at the moment, the evidence for monetary benefits is still slim, and this tool it will provide more evidence so that we can build on to make sure that we are increasing our knowledge base. So the tool has a number of built-in tables that allow for the cost to be disaggregated in a number of ways. So once you've put in all of the information from the pathways and the costs and the benefits, we can disaggregate costs and spending in terms of inputs, activities, outcomes, impacts, benefits, and also time. So we can have any sort of combination. So we can have impacts by year, we can have in outcomes to impacts to year. So any combination of these, as long as the level of detail has been put into the tool. So in addition to the tool itself, the tool is accompanied by a more comprehensive methods note. And the methods note walks through the tool step by step in more detail and also provides examples to help answer questions about how to fill things in, what's actually required, what's optional, and includes a number of annexes with specific details. So why are we interested in cost-benefit analysis? Mostly right now, we have a lot of competition for very little money, and it's important to show that nutrition is beneficial in both outcomes, in health outcomes, in non-health outcomes, and in monetary terms. And we need to identify what the gaps in evidence are and work to fill those gaps so that we can make a powerful argument for why nutrition needs to be included in our programs. It's also important to emphasize that the impacts of nutrition include more than just health effects. So we want to be able to show benefits, all levels of benefits that come from improved nutrition. These have a compounding effect on labor, on the economy, and overall welfare. The CBA tool builds on the existing capacities to fortify arguments. So it builds on the agri-food systems pathways tool and also the agri-food costing tool that was the precursor to this. When all of the pathways are well defined and benefits are identified and monetized, the CBA provides a way to compare programs and activities to make the most cost-effective choices for improved outcomes. So if you can monetize both the costs and the benefits, then you're able to make an argument for whether the activity itself is cost effective, but also whether it's more cost effective than another activity or program. So providing tools that build on each other, including consistent training, will help us build evidence and resources in a consistent and comparable way. So what does it take to complete the BCA tool? Okay, as already stated, we need a combination of expertise in economics and nutrition programs. And the tool is set up for ex-ante analysis. So this allows for cost evaluation design to be completed hand in hand with the program development. And this is an important piece because a lot of times we think about costs after the program is over, like how much did that cost? How much did we put into this, into different areas and different inputs? But the indicators have not been set up. If you think about analysis ex ante, you can combine the indicators along with other measurements that you're using for the program. It's set up in alignment with the agri-food systems pathways approach. So we have a standardized approach to doing this. And the tool itself is built off a number of existing tools, including the MCC Nutrition Toolkit, the SEAMS Nutrition Guidance out of the University of Washington, and then again out of the Agri-Food Systems Pathway to Healthy Diets. So there's 4 basic steps that we're going to talk about next to get from the pathways to the costs and the benefits. Okay, so step 1, it's important to understand what is being evaluated and how. So before defining the scope of a cost-benefit analysis, we first have to understand the program. So this will come from the program description and the agri-food systems pathway, and will be provided by the nutrition program expert. So the program goals and objectives include the outputs, the outcomes, and the impacts. We also need to know the target population because this will help us calculate return on investment. Right? So how much does it cost per person? How much does it cost per school? Once the program is well understood, we need to define the structure of the cost-benefit analysis and develop an evaluation plan. In order to do this, we have to fully develop the evaluation questions. What is it we really want to know here? Do we want to know what it will cost to implement the same program in multiple places, so in scale up? Do we want to know what it will cost to continue this program at a larger scale? Do we want to know what it's going to take to just continue the program as is over time? So we need to know whether the interest is program implementation, routine monitoring. Do we want to look at financial costs? Do we want to look at economic costs? And also, what is the cost perspective? So whose costs are we concerned about here? Often we're looking at the payer costs. So the funder might be interested in how much it will take to develop the program and get the results that are expected. But we also might want to look at the cost to the consumers themselves. So households. We might want to look at all costs, the societal costs. Is it what is going into this entire program? Who's bringing what to the table? And this is vitally important because in order to do a cost-benefit analysis in a consistent and rigorous way, we have to match the costs to the benefits provided. So if we are looking at funder perspective, what is the funder providing and what is the funder getting out of this, right? So they have to align. Costs and benefits have to align. And so we need to make sure we have that figured out before we start the analysis. If you have a narrower perspective, like the funder analysis, it's much easier to do the analysis. But the broader perspective, like the social perspective, gives you a more comprehensive analysis, but also is more difficult to implement. So being ex ante, it's an opportunity to build in data collection methods to account for costs and align benefit indicators into the program itself. And that's very helpful. Although I should say also that while this tool was designed to be ex ante, it can be done post program as well. So the other thing we need to think about is the time horizon. Are we interested in just the startup? Are we interested in the length of the program? So we may have a 3-year program and we want to look at what are the 3 years of costs. Or you might want to look beyond that and say, what will this cost over a 10-year period, for example? We probably will not be doing the analysis over a 10-year period, but if you can develop the cost structure, you can do an evaluation that looks at over 10 years. But again, you need to align the costs with the benefits. So with a well thought out plan, we go into step 2 and we collect the data. And the data collection tools for the cost can be developed prior to the program implementation because it is ex ante, and then can be incorporated into program monitoring. So we can do a bottom up or a top down costing. And again, this depends on what level of detail that you have. Some budgets do have input level costs. In order to do an input, in order to use input costs, you have to know how the input fits into the activity. So one of the things that needs to be done here in the tool, and the tool sets up the way to do this, is if you have an input budget where you say, here's personnel, you need to distribute the personnel over the activities that they do. If you have supplies, you have to connect that input to the activity. So you take all of the inputs in your budget, all of the resources, and map those to the activities that they contribute to. Okay. Sometimes you don't have that level of detail and you just have the activity, but you have the budget for the activity. That limits what you can say at the end, right? We can talk about this activity provides this benefit. It does not allow you to disaggregate by those smaller inputs. So again, the level of detail that you put into the tool itself will give you more detail at the end. In practice, we find that cost detail may vary based on the activity. So if you have an entire program, some of it may be nutrition specific, some may be nutrition sensitive. Nutrition specific tends to have a much more, we're able to get the costs and the benefits with much more clarity than nutrition sensitive. So sometimes you might have a mix of approaches even within the same analysis. And that's fine. We work with the evidence that we have, and then we build on it from there. So what we don't have from our program budgets or from our plans, we can look at secondary data. So we can think about similar programs, the cost of similar programs in the area, or we can look at the same program that's done in another region. So there are other places you can go because, again, if this is ex ante, we haven't done the program yet. We may not have specific information about how this program is going to operate 5 years down the line, but we might be able to use a similar program to make some estimates. And then expert opinion from implementing partners is important. They are the ones who are actually doing the program and have the most details about how the program is going to work. So step 3 is estimating the value of the benefits. So as I said before, we have to make sure that the costs and the benefits align. And we should, with the pathways, have already set up that approach. Right? We know what activity leads to which outputs, to outcomes, to impacts. So we should be able to use the outputs through the impacts to define what the benefits are that we need to evaluate. The most relevant sources for defining benefits come from scientific literature and from other program activities that have already been done. So more details about how you can connect benefits to each piece of the pathway are detailed in the methods note with examples. And over here on the side of the slide, it shows some examples of the benefits that you might be able to use. Once the benefit categories are identified, we need to quantify them. Okay? And that can mean monetize them, but it can also just mean just using some other indicator, such as lives saved. So how many lives were saved by this particular intervention? And there are tools for that. The LiveSafe tool does estimate the impact of health and nutrition on in certain areas, and you can adjust that model for your particular context. And then we can also look at how changing the model will change, and the change in intervention coverage will change the outcomes. You can also take that to the next step. There are studies that show, what is the value of life. There are arguments around monetizing lives saved, but there are definitely studies out there that will allow you to make those connections. There are certainly studies that tell you that an increase in nutrition will increase labor productivity and GDP. So some benefits are easier to value and measure than others, and some are more controversial to measure than others. But there is a lot of literature out there that does monetize different interventions. And this requires the economic expertise of this team that's putting the information into the tool. It also requires assumptions and often subjective decisions. And this is often where the arguments come, where people start to say, well, no, this isn't right. You should be looking at this instead. You should be, we should not be putting a value on this. It's very important throughout this, when you start making jumps from quantifying to monetizing, that you document your assumptions very clearly, so that everyone knows what it is, how you got from one piece to the other, and if they want to adjust that based on other scientific information, they can do that to add on to the evidence that you're providing. And then Annex 6 of the methods note contains a lot more guidance on how to monetize and how that works in practice. All right, so our last step is connecting the cost to the benefits and making that comparison. So once we've monetized the benefits and we know that they align with the costs and the cost perspective, we can express the comparison in a number of ways. The way that the tool is set up, you can choose to either look at it as a cost-benefit analysis or cost-benefit ratio, in which case you're saying, how much does it cost to get, let's say, €1 of benefit? Or we can ask the reverse, and we can say, well, what is the benefit we receive from spending €1? Then that's just a benefit cost. So it's just a ratio that is flipped. So when you look at it as a benefit cost analysis, you want a value to be greater than 1 to be cost efficient. And if you're looking at cost benefit analysis, you want the value to be less than 1. So there are a number of challenges. The tool provides a standard way to build evidence to make more informed decisions about cost efficient spending. But none of these activities that we're talking about are simple cause and effect. The pathways are very complex, and it's difficult to make direct and exclusive links from a specific activity to a single impact. So there are co-benefits of investments, and there's multiple activities that all may lead to the same impact. So we do take account of that as much as we possibly can, but these are, especially as you go over a longer timeline, are very complex to make a specific one-to-one match. So again, that makes it very important that you make your assumptions very clear about how you're making these calculations. Double counting can sometimes be an issue, less so when you have a very clear and defined pathway, and the time scale matters. When we're looking across time, things get more complex. So I'd like you to think of this tool as a living document. We're not going to get all of our answers immediately. The evidence is not all out there, but each evaluation that we do will add to our body of knowledge and build the evidence base. And that's the end of my presentation. Thank you.
Thank you so much, Helen, for this very clear presentation. And already there have been questions if you could share the presentation. So I will leave it also to Fabio to understand if the presentation are then shared. but they are certainly part of the recording. I'm passing now the floor to Tikian, who will continue to explain how this approach, including the costing and monetizing the benefits, has been applied to the Madagascar experience. So you have heard from Clément how the pathway were articulated as the foundation, and now Tikian will discuss how this has been used for the costing and monetizing. Tikian, over to you. Thank you.
Yeah, thank you, Patrizia. Yeah, so I hope you can see my screen. Helen just presented what we can expect when we use the benefit cost analysis tool or cost benefit analysis tool, and what we can expect through the e-learning as well, which will walk you through the different steps. But alongside that, as Patrizia mentioned, I'd also like to highlight the key advantages of using the benefit cost analysis in your projects, and I'll be mainly using the Madagascar example that Clément presented earlier. So as we saw from the previous presentations, impact assessment for nutrition-sensitive investments is an extremely valuable tool and for countries, and it's in high demand. However, there's no formal method at the moment for rapid cost-benefit assessment in agri-food systems for nutrition. Some of the tools, such as the new investment tool for GAIN, do exist, but they use a scoring system, and it's quite generic. There's no analysis that allows you to input the different pathways from your activities, from your nutrition sensitive or specific activities, and include specific sort of summary statistics for each of those different pathways. So one of the main goals for us going forward is to simplify the use of the benefit cost analysis approach, and the e-learning is the first step for us in doing so. Now, going back to the Madagascar example, if you recall, Clément presented the consumer behavior sub-pathway. Of course, this is illustrative, and we are not limited to just this pathway. Also, Clément showed you earlier this supply chain and ecosystem pathway and food environment pathway as well. But using this as an example, cost per activity and cost per benefit cannot be accurately established. Through the existing pathways approach, we can only understand through an aggregated impact of all activities what certain indicators demonstrate to us. For example, the knowledge, attitudes, and practices improvement at the household level, especially amongst women in the target beneficiary groups, increases in nutrient intake, and of course, ultimately better diets and lower prevalence of stunting. So one of the comments as well from Madagascar was that it was useful for us to further understand then what the benefit relative to the cost is and how to break that down. I saw from the Q&A as well that there were several questions regarding country-specific activities, and here are some of the projects that we have done in the different countries for the agri-food system pathways approach. And I just wanted to show this because this is the benefit cost analysis that we are doing specifically is something new that's only come up in the past 2 years, well, last year even, right? So in all these countries, they have demanded that we have a more thorough, detailed impact assessment. And that's something that we have been working on in response to the demand. So far, we've only done benefit cost analysis in 2 countries, but we really do look forward to implementing it more further. Right. So again, back to the Madagascar example, using the tool that Helen presented earlier, we were able to disaggregate costs per food system component, as you can see here in the pie chart. For example, the total budget for the project is approximately $466,000, and it amounts to approximately $38 per month, or 933 per household. And we can further disaggregate that into 38% for ecosystems, 8% for consumer behavior, 25% for coordination, and so on, right? We are also able to disaggregate the cost needed to achieve certain benefits because we understand those pathways. For example, the increase in household income was achieved through approximately 31% of the investment, which is quite effective if you refer then to the next slide. So as you can see here, right, based on the amount that we invested, we were able to achieve 7.87 US dollars for every $1 that we invested. And this only refers to the monetizable part of the analysis, which is mainly the farmer income and partially also the life saved, as Helen indicated earlier. We can see that each household received 242 US dollars in addition to the income that they were already earning. And we were also able to conduct cost effectiveness analyses as well for the different indicators that we were not able to directly monetize, such as Clement mentioned earlier, right? There's a standardized food basket that we help to promote and help farmers to produce. And as part of this basket, we increased the vitamin A intake by approximately 58% of daily needs. Households also improved their behaviors, with 70% able to identify at least 3 nutrient-dense foods. Households were learning how to prepare recipes using the foods from the basket, and at least 62% were participating in this, and 81% used their own production as part of this. So why was the BCA tool effective? As indicated earlier, for Madagascar, this was something they really appreciated in terms of impact assessment, was able to help project implementers not only with cost benefits, but also provided metrics to inform prioritization and scaling up. For example, identifying that certain activities resulted in the outcomes that they prioritized the most, and then choosing going forward to invest more in those. It also serves as an advocacy and resource mobilization tool, as it helps with demonstrating to donors, to investors, that this is clearly, a cost-effective way to invest in the different projects, not only for nutrition, but also for maybe other components of the food system, right? And so through our e-learning, you will be able to go through both the benefit cost analysis theory and practical implementation through an illustrative worked example and exercise to get you started on using this tool. And in our subsequent work, we will also aim to organize virtual workshops for those who require more hands-on support in using the tool. And we also recognize that at the moment, we don't have a graphical user interface, and we will be working on migrating the tool to a more user-friendly medium going forward as well. So yeah, that's all for my presentation, and I'll hand the floor back to Patricia.
Thank you so much, Tikian. Thank you to all presenters, and also thank you for a very dynamic audience, because we have received many questions. Fabio, do I have 5 minutes to ask question to our panelists?
Sure, please go ahead. You can select those questions that are most relevant.
Yes, thank you. I would like to pose the first question to Dr. Zarina, and is one of the initial questions we have received. And how do you account for the political will, since you are working in that domain? How would you answer to that question? Thank you, Dr. Zarina, from your experience.
Thank you for the question. Actually, to gain political will, we must do continuous advocacy on nutrition. The important to integrate nutrition at all levels in the food system. I think most of the stakeholders may not aware their role and what they can contribute to the betterment of nutrition for the population. I think the most importantly is the continuous engagement and advocacy to them. Yeah, that is my answer. Thank you.
Thank you so much. I now move to a challenging question for Clément. And it's a question, I don't know if you have seen that, on how would you, what is the evidence? How would you go about assessing the implication of consuming packaged food from PVC, and what kind of solution you would propose? I know that, it's not here, we are not discussing the evidence, but how would you go about it using the pathway approach?
Yeah, actually, I saw the question and I found it very specific. But what I will say without going too deep into the details is that the approach that we are using try to address all kind of situation, even contexts that might be affected by or affecting food safety. So what we try to do is, as it's a multi-stakeholder approach, is to involve all the actors that are part of the agri-food system. So in this case, if we identify that the use of those package is related to one of the private sector actors, the idea will be to see how we could involve those actors in such a way that we could address these problems within the specific food system that we are working on. So I guess what we have to keep in mind here is that our approach is highly participative, and we try as much as possible to invite and involve all kind of actors, even the ones that are belonging from the private sector. So, and try together to address specific problems that might have been raised. Thank you.
Thank you so much, Clément. I have now a question to Helen. Again, we had a very interesting one on how far we have used the BCA to assess nutrition education programs in Africa. And again, we haven't used it that far, but how would you answer to that question, also in view of what could be done with the existing evidence and with the kind of tool that we have tried to develop together? Thank you. Over to you, Helen.
So I think that question can be more generalized to what do we do with the more nutrition sensitive approaches. And what we try to do is within the pathway is to say, well, what is the additional, what are we adding to this program to make it more nutrition relevant? And how does that change the nutrition outcome? So it's matching that change to the program to the change in outcomes that's important. And you can do that within education or WASH or any of the other relevant sectors.
Thank you very much, Helen. And the last question is for Tikian. And there was one specific on climate and resilience. And over to you, Tikian. How would you answer to that one?
So, sorry, the full question is on how can we implement this in climate and resilience?
Exactly. In climate, in program that also address climate and resilience, or in program that specifically address climate and resilience.
Right. Yeah. So in general, this approach, right, is not meant to be specific only to programs that are looking at nutrition, but we are looking to integrate nutrition into different agri-food systems programs. So this may be related to resilience activities. This may be related to climate sensitive programs, for example. And this aims to sort of demonstrate how effectively we can invest in different activities for nutrition whilst complementing or looking at co-benefits to the existing, let's say, climate-sensitive activities, for example. And in many of the cases, for example, the one that we looked at with Madagascar, it's actually necessary for us to consider climate-resilient agriculture, for example, in production of many of those crops. And that has a direct impact on nutrition. So from that way, using the pathways approach, we can identify those synergies, and we also are able to look at the benefits and the costs associated with those different activities. I'm not sure if I should say this now, but we also look to integrate with some of the other benefit cost analysis tools in the FAO related to climate, such as the exact tool, is something that we're trying to work on as well, so that we can do this more effectively. Yeah, over.
Thank you so much, Tikian. And I am very pleased to pass now the floor to Christina. And I really would like to thank her very much for what the FAO e-Learning Academy is doing, because it's really having an impact all over the world. And we could see also from the audience how many people were connected really from all the regions in the world. So Christina, over to you for the final words. Thank you.
Thank you. So thank you so much, Patricia. It was a pleasure to work with you and your team. And I'd like to also thank all the speakers. I just wanted to spend the next few minutes just to explain, so where can we find these courses? We talked about their value, how they can be used at national level, their importance, but where do we find them? So this is just to show you the FAO e-Learning Academy. This is the website. And here you immediately have the costing and monetary benefits course, where by clicking you can already see that it's also part of a series, as it was mentioned during the webinar. So I don't know why it is that slow, but let's see. Just a second. Do you see my screen?
Yes.
Second, I don't know why. In my case, it's all blank. So just a second.
Not anymore.
I'm trying to share again, but so if it's not possible, it doesn't matter. Just a second. Let's see if you can see my screen.
Yes.
Yes, we can see the screen.
So what I was just mentioning is that you can reach to these courses that were mentioned in different ways. One is by since it's the latest one, by clicking on it, you can directly access the course. As you can see, and as mentioned, these courses, all the courses offered by the Academy are all certified courses. So this means that by doing the final test that is associated to the course, you earn a digital badge, which has quite a value related for the professional market, but also for students. And you can see here on the course page that you can access also the other course that was mentioned, which is the Agri-Food System Pathways, that is also certified. But what I also wanted to mention is that you can also find the course by selecting the thematic area. So by selecting food security, nutrition, and health, you can find the course. And you can also find those that were mentioned, for example, by Zarina earlier, or by the other speakers. We have courses on advocacy for a multi-stakeholder, multi-sectoral approach to nutrition. This is another course which is very relevant to the ones. Or we also have courses on how do you implement programs, what is the relationship between nutrition, food systems. So you can really, for example, how to design and monitor nutrition-sensitive agricultural and food systems programs. So these are courses that are directly relevant to all the different topics that were mentioned today in the presentation. So I invite you all to have a look and to earn your digital badge. as have done over. So as you know, the FAWI Learning Academy has now over 2 million professionals worldwide that are benefiting from their courses. So we really hope you will be one of them. And I would like to conclude by thanking everyone for this excellent webinar. Thank you so much. Bye-bye.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank you, everyone.
Brilliant.